Okay, so my name's John Hopkins. I'm an SME and very much on the S, the small of the SMEs. Just to give you a little bit of background, we were formed originally in 2011, but really got going a couple of years ago. We're based in the Northwest, and what we actually do is develop healthcare applications focused on acute and community areas. What we're trying to do is develop software that is very, very easy to use, very innovative, and very intuitive. So there's a reduced amount of training that goes around it, but it delivers, significant benefits to both acute and community areas. So we're also working with local academia, John Moores University in Liverpool, looking at some of the new innovative technologies around sensing that's coming out of their labs and integrating them into the product that we have. So the focus that we have is on patient monitoring and management of conditions in real time, simple, easy to use, improves post-operative care, reduce hospital stays, and obviously affects overall health costs by reducing stays and reducing unobserved deterioration of patients. So reducing the level of care input that patients need over their stay in hospital as well. Okay, so I'm here to talk about the NHS and our experience of dealing with the NHS and procurement. The NHS is out there looking for innovation. Why are they doing that? Obviously to improve services, but there is a lot of changing practice going on out there at the moment. There's a need for patient involvement, different methods of condition management. To actually move forward, there is a need for innovation to engage the patient. So the NHS requires innovation to drive that change, support new clinical practices, deliver efficiencies, and also to audit the work that's actually being delivered for patient safety and for staff safety as well. Right now, there's very much a focus on managing ill patients and the management of recovery, where we need to shift that away from that to really stopping people becoming ill and going into crisis. So managing the condition at a much earlier stage, educating patients to allow them to be much more involved in the management of their own care. One of the issues that we deal with at the moment as well is that patients the patient wishes are very often overlooked, and the patient opinions of what care they should be getting is very often overlooked. Okay? In terms of, Lord Young said a little while ago, I know he's moved on now, but moving forward in terms of procurement issues, if the NHS and social care could actually bring together, so a set of standards that all suppliers could work to. I know we are moving forward on that, but if there was something that all procurements went through that was standardized across the piece, that would be very, very helpful. What's been done so far? There's a procurement development program in process, SBRIs, TSBs. This is allowing small, innovative companies to engage with the NHS. And that's important, but it's still difficult as a small company to engage with the NHS as a wider body. So in terms of NHS procurement, the innovation that the NHS is looking for, I believe, in the main comes from small companies. It doesn't come out of the large multinationals. They're not fleet of foot, they have their internal processes, and it's difficult to move things forward. In many ways, it's not their fault because they have a huge number of customers that are all demanding things at the same time. So it's difficult for them to move forward, where SMEs, and the smaller range of SMEs, they're fleet of foot. They have to be. They have to have a unique selling proposition. So they have to be in advance of the larger companies. Otherwise, they don't get a look in. To compete with the larger providers as well, we need that advantage. We need to be unique and out there. Barriers to innovation that we see is that there isn't enough early engagement in the process of suppliers or of clinicians, and that needs to, looking at the problem that needs to be solved. Quite often, when you look at a procurement at the point of competition, there's a set of requirements which have been produced, which really, when you read them, don't give you a good enough idea of what the target really is. It's a set of product requirements rather than what's the end goal? What do we need to achieve? What do we have to deliver? Financial rules. Quite often, small companies are judged on their balance sheet rather than the product. So before you even get started, you're out of the procurement because you haven't got a balance sheet that supports it. There needs to be a way of reassessing the risk of delivering some of the projects and managing that risk through the contract, which, and I have to say, it doesn't mean shifting the risk all onto the supplier. It means sharing that risk in a sensible way so that products can be delivered. That is important, because a lot of small companies, when you get into the final negotiations, look at the way in which the NHS review their assessment of risk and where it's being pushed. A lot of small companies literally have to hold their hands up and say, well, we just can't do this. We can't support it because the risk falls on them. Okay. So how do we break down the barriers? I think smaller, more focused projects. Focus on the requirement of the outcome rather than the product itself, because if you get a good analysis of the outcome that's desired, you can start to look at products that will deliver that outcome rather than just say, oh, here's a product, let's see if that will meet the requirement. Clinical involvement from the outset, getting that understanding of what it is that needs to be delivered to support the change that's required. And that's very important. Having clinicians involved at that point as well, so that you can actually get to the point that they want. Also, I've been through this sort of a number of times in a number of procurements. If something doesn't work first time, it doesn't mean it's a failure. Running a number of projects to analyze what's really needed. Some of them will work, some of them won't. But out of the ones that don't work, there should be a huge amount of learning which can be applied to move things forward. Things don't always work. I think it was Edison who was once asked by a reporter when he developed the light bulb, so you failed to produce a light bulb 2,000 times before you got it right. And he said, no, I didn't. I learned 2,000 ways not to make a light bulb. So it's about switching that round and looking at what we can achieve out of it. I do believe there needs necessarily to be sort of a worry in the NHS about risk of projects. But if those projects are of the right size, the risk of failure should be turned around, and it's a learning exercise which doesn't necessarily have to impact on that move forward. Statement from development program for NHS. Procurement has a key role to play in frontline care and ensuring that we can actually move forward and support the spending rounds. So supporting the changes in the NHS with technology will help support the budget if we get it right. So what can we do to fix this in moving forward? How do we drive that innovation that is really going to support the management of budget in the NHS and deliver services to an ever-growing sort of population that needs input? So we need to look at small pilots, look at the areas for improvement. We need to do something in community because community is not working properly. Well, that's a huge task to look at. What do we need to look at? Do we need to look at congestive heart failure or COPD? How are those services being managed, and what can we do to improve them? So focus on what the need is and look at what we can do to support the changes needed. Seek out new innovation in that area. Look at what's on the market and how it can support the innovation you're looking for. Small paid-for pilots. It's very important. Small companies, SMEs, can't do things for nothing. We have to feed our children. Honestly, we do. So it's about making sure that it's sustainable. It is moving forward, but they need to be paid for. Define the outcome that's expected and measure it. So don't start from a wish list that is unachievable. Look at what you want to achieve and how you're going to measure it, so that that is part of the project itself. So at the end, at least you can go back to it and say, did we achieve what we expected? Learn from the result. If it doesn't work, you found out a way not to do it. Move forward. Use that to make sure that the next project you move into addresses those issues. Okay? Reassess the risk. Small companies don't have extensive balance sheets. So you need to balance that risk so that small companies can deliver innovation in a secure environment. We're not asking you to put £1 million on the table or £10 million on the table. You know, it's £50,000. Move it forward, pay it in stages. You know, so it's managing the risk from your end. It also manages the risk from the SME end. It doesn't mean if the small, you know, just going into this one, the company may not have a recognizable turnover. Quite a lot of the questions when you go into procurement is, can we see 3 years balance sheet? Well, we've only been going for 2 years, so we don't have 3 years balance sheets, so we can't show you that. It doesn't mean that we don't have a good idea or a good product. Look at the product and not the balance sheet. Look at the idea, not the balance sheet, and see if it supports where you're going. Also, assess the product and the people, because projects are delivered by people. Are the people in the SMEs passionate about what they want to achieve? Do they have a clear idea of what their product or idea can deliver to the NHS? If you come in and present and you woolly about what your product is and what it does and what it can achieve, well, no, you really shouldn't be talking to those people. But if the people who are standing in front of you with a product can identify and articulate the goals and the aims of their product delivery, they're the people who you should be engaging with and moving forward. You may in the end find that it doesn't fulfill your needs and move on, but it could be something that could be a nugget in there that you want to take forward. Reduce the risk to the NHS and to SMEs. More projects, less cost. Do 10 projects, maybe 7 won't have the desired outcome you want, but 3 might. If it works properly, those 3 will more than pay for the other 7 by delivering cost benefits to the NHS. So look at a broader spread, focused ideas, more products, more projects. In doing that, you're limiting your exposure. You're not spending, I was going to say 6 billion, but let's say £1 million on a product that in 2 years' time you find out just isn't working for you. Use the evidential success to exploit. Take the learning and push it forward. Develop other strategies on the learning experience of the projects that you've been running. Share the results. Too many times I've seen one trust or one organization will do some really, really good work. Nobody knows about it. Whether it's just a strategy or whether it's a product implementation or the way in which data is being used to feed back into the loop to improve the service delivery. Quite often that is held within a trust. I know there's competition between trusts, but really that data should be out there and should be used to drive forward the innovation. Use that to promote success. I think one of the tasks or one of the opportunities the AHSN has got is to take the data from a number of different trusts, bring it together and promote that success and look at how that can be driven forward. Deliver improvement. Successful projects find a way of fast-tracking them. Promote them, put them on framework agreements, make sure they're publicized to other trusts who can then pick them up and run with them. Learn from success and failure. It's back to what we've spoken about. A project that doesn't deliver what was expected is still a learning exercise and will support the success of others because you've learned how not to do it. Drive innovation with knowledge. If you're doing a number of small projects, I believe you build a huge amount of knowledge about the area you're trying to evolve, you're trying to change the way in service delivery is managed. If you utilize that knowledge to drive that service forward, it's going to be much better than just sort of looking at a bigger scenario and thinking that a wider community product or a wider acute product will solve all your ills. It won't. You need to get down to the service delivery level to really look at how you can actually drive the success and drive the innovation. I think it comes back up to sharing results, build on the success. If it works in one place in the NHS, in the main it should work everywhere. Okay, there's going to be local differences, but we should be able to manage those. But if it's successful in one area, it should realistically be successful in another area. Efficient procurement that delivers. One of the things that SMEs obviously often struggle with is the length of time it takes to do a procurement. You know, sort of, if it's 6 or 9 or 12 months, that's a lot of effort and a lot of cost in terms of the balance sheet for an SME to engage in without, you know, the opportunity to get revenue in from that for a long time. So that's important. I have to say my worst experience was in Northern Ireland, and I was involved in a 10-year procurement product that in the end didn't actually deliver a contract. So that was a little bit disastrous, but there you go. So efficient ways of doing the small projects. So quick turnaround, and build on that to feed back the results and look at where the next set of projects is going to come from. I think that's very important to SMEs. So really it's a balance of risk sharing and how we can deliver innovation to the NHS. I think that is my last slide. Yes, it is. Okay. Thank you very much.